until a couple years ago, there was not a lot of appetite to go for a second transplant after having a relapse. But some centers, because there was a later relapse or the kid or the adult was in a pretty okay clinical condition, so some of the centers started to do second allo transplants, and that's what we did in the Princess Máxima as well as MSKCC, so the center where I'm in now. And in the abstract you are referring, we have collected the data from these two centers. And yes, it is a relatively selected group of patients because they were all in a pretty okay clinical condition. They all had a relapse more than 6 months after transplant, so relatively late. And with the data and from a couple of centers that using cord blood as a cell source, you may get better disease control, we decided to transplant these patients only with cord blood, because there is data from a couple of centers that if you are, even when you are MRD plus before allo transplant, you still are able to get relatively good disease control. So in this analysis, 20 plus 23 patients or so, 25 patients, we got an overall survival of 65%, which for a second allo transplant is not bad. That's pretty okay data. That's almost similar to the outcomes after a first allo transplant. And we think, and we should prove that, of course, obviously in a larger clinical trial, that using the cord blood as cell source, that's the main driver of, let's say, getting good disease control in a second attempt. And what I can tell you more about this dual center analysis from MSK and the Princess Máxima is that also the non-relapse mortality, so the toxicity, is not too bad. Yes, overall in the whole cohort it was about 20%, but when you look at the most recent cohort, there was no transplant-related mortality since 2015. So it's a good option for pediatric patients, young adult patients who relapse after first allo transplant, who are in a good clinical condition and have a relapse a little bit later on, not very early, within a month or two, using an unrelated cord blood to try to get disease control in a second attempt.